Hello guys, hello. Hello, welcome to the new vlog, not vlog, live video. Uh, Today I am going to read again Ellen's keynote. Few medicines are remaining. After that, I'll stop reading and I'll start solving the MCQs. So there are few books from which I will solve the MCQs. Uh, Yesterday I was learn about deep knowledge homeopathy. It's wonderful. Oh, thank you, sarcastic boy. So what you learnt exactly? Tell me, so that I can you share your knowledge, and I'll share my knowledge. You share your knowledge about homeopathy, what you read, and you can. I will increase your knowledge more about homeopathy. What you yesterday? What you learned, from where you learned, from where you asked, simillimum and all things. Okay, that is theory part you read. Okay, that is theory part you read. Uh, it's good. Principle of homeopathy. Okay, that is also good. So how it differs from allopathy? That is a main question. Homeopathy differs from allopathy. At what point, in what all terms, homeopathy differs from allopathy? I have a senior who is an orthopedic. ओके वो ऑर्थोपेडिक है, तो होम्योपैथी में ऑर्थोपेडिक कैसा, मतलब एमबीबीएस ऑर्थोपेडिक, ऑब्वियसली एमबीबीएस ऑर्थोपेडिक, तो उसको कैसे नॉलेज है, उसको कैसे ये पता है? He gave symphytum to many. Oh, that is good. Actually, symphytum is a bone union. It reunion the bone. If a fracture is there, so it is given for the reunion of the bone. Yeah. He also believes homeopathy up to some extent. Okay. Okay. That is good. Symphytum, arnica, ruta, bellis perennis. There are lots of medicines. Rust stalks. Lots of medicines are there. Allopathy create opposite symptom, whether homeopathy is similar. Yeah, that is. No. Allopathy creates not. Allopathy treat in a opposite way, right? That is only antipathy, right? If person is having diarrhea, then you will stop that diarrhea and you will create a constipation. If I have a vomiting, then you will give me antiemetic, right? That is only, no. You give me antiviral. Are you doing post graduation? No, I want to do. For that only I am studying. For that only I am studying. Uh, uh, I think June. I think in June exam is there. For that I am studying. I want to do a post graduation. If not, then I will start my clinic. Presently, I have a clinic in my home only. Now, what are you doing? Yeah. Now I'm told, I 6 or 7 months I worked in a allopathy hospital just to know what is exactly happening, and after that from 2024 only, uh, when I completed my BHMS. After that I started my clinic in home only. Few patients are there that I am treating, and yeah, that is only. And I am preparing for the PG. Yes. RMOship, I did RMOship. Where are you from? Where from? Yeah, I am from Mumbai. Yep. I'm staying in Mumbai. Yeah, I'm from Mumbai. Mumbai is very good place to run homeopathy. No, 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 no. That is wrong. Mumbai is not good place to run homeopathy actually. Mumbai is very fast city, you know, everyone is busy and everybody needs instant relief, you know. At if they have a headache, they have any kind of problem, I think many people are aware of it. Yeah, but the thing is like we also know, you also know, homeopathy people are very in Mumbai very fast, in the sense they want everything like this. If I have a problem, I want solution in this, you know. They don't want to wait. So for that, and in Mumbai where I am staying, lots of government hospitals are there. So they don't go to they don't want to go to any clinic. They directly go if they have a headache, if they have a abdominal, any kind of, if they have a some kind of just small chest pain, but they are educated. I think then they will go to the government hospital only, as compared to Nashik. As compared to Nashik, as compared to Nasik, yeah, as compared to Pune, Pune is better than Mumbai for homeopathy. That I can say. Pune is better than better than Mumbai for homeopathy. Yep. In Mumbai, rent is very high. Rent, clinic rent, other expenses are very high. So uh, anyway, people know that homeopathy is very cost effective. So because of that, we can't ask much also for consultation and medicine. There are many homeopaths, they are asking more, but in starting only we can't ask much to pay this much my charge, this much my consultation fee. So for that I did not start my clinic. I did not, you know, in a hurry worry I did not do anything. I just waited, I just worked, I just knew, I just want, even I want to know more. I, you know, and when I was working in a hospital, I knew, I started knowing many things, you know. So yeah, how much time it need to run homeopathic clinic? You have any medical? No, 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 I don't have any medical. Yeah, so the thing is like, see, for every anything, I don't have any background. The only question is like I don't have any background as a doctor, so I have to start from the zero. I have to start from the bottom, and yeah, that is the thing. If uh, people people are educated, people wants to come, but yeah, it will take time. Around 6 months, it will go. 6 months around, it will go. It will take. So I have decided. I have decided if by chance, if any, if my bad luck, if I don't get any government job, any government not job, any government college in homeopathy, then obviously then I'll go for my clinic. I will do my clinic. Does MD occurs even after BHMS? Yes, 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 yes. MD is there. And what's syllabus? Syllabus. Yeah, MD in, see, MD in Matremedica, the main subject. MD in organon, that is the root of the homeopathy. MD in repertory, that is a tool, kind of tool. One tool is there, that is also, I mean MD. Then even in MD in medicine also. even even in MD in medicine also you can do. So there are many branches, but not like in a like in allopathy, dermatology or orthopedics. These branches are not there. I heard, I saw in many posts, Ayush post, like okay, in homeopathy also it's going to start, but I don't know when it will start. But yeah, these branches are there. MD in Mathematics, Organon, Repertory, and MD in Medicine. Yeah, even medicine also. I mean you have to give NEET PG. No, AIPGET. That is AIPG. NEET PG, yeah, that is only AIPGET. That is the thing. So that for that only I am preparing AIAPGET exam. So what is your plan to do after after completing your internship? Just MBBS doctor, or you want to do any specialized? I have a cousin who is also doing post graduation from Ahmedabad, but college, but he does not go. Okay, in Ahmedabad, I know. Yeah, yeah. That they what exactly happens in some other cities? What exactly happened there, where the homeopathy is not so flourished, or the college is like not so demanded. So there, what exactly happens is like, okay, you take admission and you go. I want to be a cardiologist. I don't know. Yeah, okay. I want to be a cardiologist. Or what exactly happens? They take admission and start they whatever they want to do. They go for they take admission. They pay the fee for 1 year, and they do the settlement and all things. After that, they will sit at home, or they will start their clinic, or they will do RMO-ship, as you said. Like many homeopaths, they do RMO-ship. They do RMO-ship, and after that, day to day, like proper timing, they will go for the exam and they take the degree. That they do. Yeah, it is good. You do cardiologist or dermat. Yeah, it is good. Cardiologist, I think, yeah, it is good. But dermat, we have more scope than allopath. But if cardiologist, yeah, that is, I salute cardiologists. They are master. They are really. When I was working in a hospital, one Shoaib, Dr. Shoaib, it is that, is it? It is, what is he? I mean dermat in homeopathy. I mean, I told you, like, in homeopathy, we don't suppress in the sense, if what you people, what I have heard, what exactly happens, I'll tell you. In a dermat case, you people uh, you people give a lotion, you people give the cream, you people give the ointment, and you apply it and it will go. But deep inside, it will affect inside other part of the body. So that is a suppression. We don't do that suppression for any external things. For any skin disease, we don't give any ointment and all. They are a patent product, but that doesn't come under classical homeopathy. So we give only oral medication for any complaint. For any XYZ complaint, we give oral things, oral medicine. No, no, this does not happen here. For MD's college, one has to do it regularly. One has to study a lot. Yeah, in so that is what I'm telling you. There are many colleges. In my college also, where I did my UG, there even for whom, even you can't. When I took admission in that college, I asked, many students asked, like, okay, I want to stay out of the hostel, but they did not allow. That depend on the college, how the college is. If college is cheap, they will do. How homeopathic student pass even without college? Yeah, that is only homeopathic student. They see, what exactly happen is like, you know, you have passed the what UG exam, and obviously if exam is there, you will read something. So for that purpose, obviously you will write something, and you mean attendance manage hoti hai, but how they passed? हाँ, attendance manage होती है. Passing in the sense, obviously you write something and uh, fill the pages, that, and at last you will pass. Some people fail also, some student fails also, but at the end, 3.5, they take more time, and at last they will pass. Yeah. That is, if you are doing specialized, like you said, cardiologist, you have to read about what's the fee for managing attendance. Yeah, that is, they take, depends on the college, they take 1 lakh for year, 2 lakh for year, 3 lakhs for year, depend on your quota. Anyway, in a government college you will not get this kind of facility. Government college you have to attend, because no one will be there to for for the proxy or for giving the attendance and all. But in the private college there are lots of college. So in that college what exactly happens is, like, you give the money, and whatever they will ask, like, okay, 1 lakh, 2 lakh, 3 lakh for 1 year. Really, I am shocked, this should not be happened. What do you think? Obviously this should not happen, because they are, these this is the drawback, no. These homeopaths, they at last, when they start the clinic, at last they will blame the homeopathy, because yesterday one quote was there, like, homeopath fail but homeopathy never fail. This happens because they don't study, and they come, after, after doing MD and all, they have a tag, okay, I have done my MD, and after that they will come, and they will start treating the patient, and they don't get the result. At last they will blame homeopathy. That is not. You have to attend the classes, you have to read, you have to see the patient. After that you will get the result. It's not easy. It's not, no, nothing is easy. See, even nothing is easy. Even if you are doing, if you want to do the cardiologist, without knowing the angiography or angioplasty, how you will do, without knowing how you will do. That is the thing. Even same for homeopath also. If I have not seen any patient in my clinic and during my internship or during my college time, then how I am going to treat the patient? If I don't, I have never seen, some knowledge I should have, no. How do they get admission? Is it so easy? Is there no cutoff or anything? Actually there are two, it is like, if government college, then you have to study, you have to get good number of marks, then only you will get the college. But in a private college, obviously you give the money, and at last you will get admission. It is not so cheap, but yeah, 2 lakh, 3 lakh per year will be there. Yeah. Government, semi-government, then private. We have regular clubbing and studies even for MD. Yeah, I know. Yeah. You people study a lot, that I know. You people study a lot. That everyone, see, we accept everything, everything. Our drawbacks and our strength, we know. चलो फिर, गुड नाइट, सी यू सून. ओके, गुड नाइट, बाय. होप, अगर आपको कुछ और भी डाउट रहे होम्योपैथी के बारे में, तो आप पूछ सकते हो, कभी भी मुझसे चैट भी कर सकते हो. और जब भी मैं लाइव आऊँ, या फिर मुझे जब भी मैं कोई वीडियो डालूँ, उस पर भी आप अपना ओपिनियन दे सकते हो, अपना क्वेरी पूछ सकते हो. इन केस अगर आपको कभी ऐसा क्रॉनिक डिजीज़ ट्रीट करने में कोई प्रॉब्लम भी हो, तब भी आप मुझे बता सकते हैं. या फिर मुझे कोई प्रॉब्लम हो, तब भी आप, एनीथिंग यू कैन आस्क. यू आर मोस्ट वेलकम फॉर दैट. ओके. Yes, definitely. Thanks. Subscribe to my channel. Okay, fine. So yesterday we read till, I have to complete this very fast keynotes. Then after that, tomorrow onwards, I will start solving the MCQs. So we'll see. So I will post. Yes, definitely. Poll. Success. Oh, yeah, fine. So yesterday I was reading the Creosotum. There only I think I stopped. Yep. So the creosote, dark complexion, slight, lean, ill-developed, poorly nourished, overgrown, very tall for her age. False. Children old-looking, wrinkled, abrotanum, scrofulous or psoric affection, rapid emaciation. Hemorrhage diathesis, small wound bleed easily, crotalus, lacusis, false. Uh, Flow passive in epistaxis, hemoptysis, hematuria in typhoid, followed by great prostration, dark oozing after the extraction of tooth, hemorrhage. Corrosive fetid ecorous discharge from mucous membrane, vitality greatly depressed. Okay. Severe headache before and during menses. In a female, there is a severe headache before and during menses. Roaring and humming in ear with definitely with deafness before during menses. Okay. Teeth, painful dentition. Teeth begin to decay as soon as they appear. This is very important. Teeth begin to decay as soon as they appear. Okay. Gums bluish red. Soft, spongy, bleeding, inflamed, sclerotic, ulcerated. Steve Thomas, hello. Genitourinary system. Incontinence of urine, can only urinate when lying. When lying, can only urinate when lying. How are your studies going on? Yeah, it is going on well. Going well. Yeah, it is very vast actually. Yeah, I'm reading still one book only. I have to start soon my solving the MCQs. So solving MCQs will be very helpful. I think. I think means many people have said. So I'll finish it very fast. Hope it will take 1 or 2 days. I have finished this much. So then I'll start my solving my MCQs. Yeah. Incontinence of urine, can only urinate when lying, copious, pale, urging, cannot get out of bed quick enough. Apis and petroselinum. During first sleep, sepia, from which child is roused with difficulty. Smarting and burning during and after micturition, sulfur. Smarting and burning all from Allen's. Yeah, first I will complete my Allen's note. Just one time I'll read. After that I will start solving the questions. And some success, like Stephen said me, is to read success and solve the uh, questions. And then I will go for the other subject also, like uh, organ and and repertory. Then I will read the medicine. Yeah, medicine is so vast. Medicine, me and Stephen read at the time of fourth year exam. After that, I did not touch medicine. For the clinic purpose only I read. But yeah, medicine I have to start. Medicine I have to read. Then other subject like anatomy, physiology, then gynec and OBG, pharmacy, these things, everything you have to read. Time is not there, much time is not there, but yeah, Okay, bro. Good luck. My exams are also coming up soon, so I have to study. Yeah, yeah, yeah. You should study. Yeah. Okay. Thanks, thanks, thanks a lot. Menses in female reproductive system, menses too early, profuse, protracted, pain during but aggravation after it, flow on lying down, seize on sitting or walking about, cold drink relieve menstrual pain. Cold drink relieve menstrual pain. Okay. Uh, Leukorrhea, acrid, corrosive, offensive. This is very marked symptom in creosotum. Leukorrhea, acrid, corrosive, offensive, worse between period, has to has the odor of green corn, stiffens like starch, stains the linen yellow. It makes the cloth yellow. Uh, Lochia, brown, Lochia dark brown, lumpy, offensive, acrid, almost seizes the freshens up again. Violent corrosive itching of pedunda and vagina. Post climatic disease of women, lachesis. Post climatic disease of women, lachesis. Lack caninum. Very forgetful, absent minded. ये play क्यों हो रहा है? Lack caninum, dog's milk, very forgetful, absent minded, makes purchases and walks away without them. Agnes, anacardium, causticum, and natrum. In writing, uses too many words are not the right ones, omits final letter or letters in the word, cannot concentrate the mind to read or study, very nervous. Despondent, hopeless, thinks her disease incurable, has not a friend living, nothing worth living for, could weep at any moment. Okay. Cross irritable child cries, cross irritable child cries and scream all the time, especially at night. Fears to be alone, calicarb of dying hours, of becoming insane, Lilium Tig, of falling down stairs, Borax. Attacks of rage, cursing and swearing of slightest provocation, Lilium nitric acid, intense ugliness, hateful. For nervous restlessness, highly sensitive organism. Symptom erratic, pain constantly from flying from one part to another, calibicromium and pulsatilla. Changing from side to side every few hours or days. Very hungry, cannot eat enough to satisfy, as hungry after eating as before. When walking, seems to be walking on air, when lying, does not seem to touch the bed. Asarum europaeum. Asarum europaeum. Respiratory system, coryza with discharge of thick white mucus, one nostril stuffed up and the other free and discharging. These conditions alternate discharging acrid nose and lips raw. Aurum, aurum and allium cepa. Diphtheria and tonsillitis symptoms change repeatedly from side to side. Okay. Shining glazed appearance of diphtheritic deposition, cankers and ulcer. Shining glazed appearance of diphtheritic deposits, chancres and ulcers. Sensation as if breath would leave her when lying down. Must get up and walk. Okay. Stomach and abdomen. Sinking of epigastrium, faintness in stomach, sexual system. Sexual organ easily excited from touch, pressure and sitting or friction by walking. Female reproductive system, menses too early, too profuse, flow in gushes, bright viscid and stringy, dark black stringy crocus sativa, breast swollen, painful, sensitive before and during. Discharge of flatus from vagina, bromium, lyco, nux, nusk mosquita and sanguinaria. Discharge of flatus from vagina. Okay. Breast inflamed, painful, aggravation by least jar and towards evening. Must hold them firmly when going down, up, down stair. Brownia and lac caninum. Brownia and lac caninum. Okay. Uh, serviceable is serviceable in almost all cases when it is required to dry up milk, asafoetida to bring back or increase it, lac defloratum. Loss of milk while nursing without any no cause, asafoetida. Okay. Lac defloratum. This is a skimmed milk. The successful treatment of diabetes and Bright disease with skim milk by Donkin was the hind which led Dr. Sarvan to potentize and prove it. Every symptom here given has been verified in the cure or the sick. Despondent does not care to live, has no fear of death, but is sure he is going to die. Diseases which with faulty and defective nutrition with reflex affection of nervous system, feels completely exhausted whether she does anything or not, great fatigue when walking. Sensation as if cold air was blowing on her even while covered up, as if sheets were damp. Okay. Dropsy from organic disease, dropsy from organic heart disease, from chronic liver complaint, far advanced albuminuria following intermittent fever. Obesity, fatty degeneration. American sick headache begins in forehead extending to occiput in morning and rising. Brownia, intense throbbing with nausea, vomiting, blindness and obstinate constipation. Okay. Epigea, iris and sanguinarian. Noise, light motion during menses, great prostration, ambulation by pressure by bandaging head tightly, argentum nitricum and pulse, copious pale urine. Lac defloratum is best remedy, even good remedy for the headache with these modalities. Stomach and abdomen, vomiting incessant, no relation eating first of undigested food, intensely acid then of bitter water of pregnancy, constipation with ineffectual urging, anacardium nux, faces dry and hard, bryonia sulfur, stool large, hard, great straining, lacerating anus, painful excoriating cries, stool, stool large, hard, great, straining, lacerating, anus, painful, extorting cries. Okay. The woman had taken 10 or 12 enemas daily. Oh, the woman had taken 10 to 12 enemas daily, often passed 4 or 5 weeks without an evacuation. Constipation of 15 years standing. That is a very bold symptom. The woman has taken 10 to 12 enema daily, often passed 4 to 5 weeks without an evacuation. Constipation of 15 years standing. Lag defloratum. Menses delayed, suppressed by putting hands in cold water. Menses delayed, suppressed by putting hand in a cold water. Conium. Drinking of glass of milk will promptly suppress flow until next period. Drinking a glass of milk will promptly suppress flow until next drink. Glass of milk will suppress the menses. Okay. Lachesis. Now the next remedy I am going to read is lachesis. It is a very interesting remedy. Surukuku snake poison. Ailment from long-standing grief, sorrow, fright, vexation, jealousy, or disappointed love. Aurum ignatia phosphoric acid. These are the elements. Long-standing grief, sorrow, fright, vexation, jealousy, or disappointed love. Other remedies are aurum met, ignatia, and phosphoric acid. Person of less melancholy temperament, dark eyes, and dispositions to low spirit and indolence. Women of choleric temperament with freckles and red hair, FOSS. Better adapted to thin and emaciated than to fleshy person, to those who have been changed both mentally and physically by their illness. Mentally excitability, ecstasy with almost prophetic perception with a vivid imagination, great loquacity, agaricus and stramonium. Agaric, agaricus and stram. Wants to talk all the time, jumps from one idea to another, one word often leads to another story. Climacteric ailment, hemorrhoids, hemorrhage, hot flushes and hot perspiration, burning vertex, headache, especially at or after the menopause. Sanguinary sulfur, women who have not recovered from the change of life have never felt well since that time. Left sided principally affected, disease begins on left and go to right side, left ovary, testicles and chest. Great sensitiveness to touch, throat, stomach, abdomen, cannot bear bedclothes or night dress to touch throat or abdomen. Not because sore or tender as in apis or bell, but close causes an uneasiness, make her nervous. Okay. Intolerance of tight band around the neck or waist. Extremes of heat and cold cause great debility. Drunkards with congestive headache and hemorrhoids prone to erysipelas or apoplexy. All symptoms, especially the mental, worse after sleep, or the aggravation may wakes him from sleep, sleeps into aggravation. Wait. All symptoms, especially the mental, worse after sleep, or the aggravation wakes him from sleep, sleeps into the aggravation. Unhappy, distress, anxious, sad. Aggravation in the morning and walking. The least thing coming near mouth or nose interferes with breathing, wants to be fanned but slowly and at distance. The least thing coming near mouth or nose interferes with breathing, wants to be fanned but slowly and at distance. Rapidly Carbovich. As soon as he falls asleep, the breathing stops. As soon as he falls asleep, breathing stops. Great physical and mental exhaustion, trembling in whole body, would constantly sink down from weakness, worse in the morning. Sulfur. Tuberculum. Hemorrhagic diathesis, small wound bleed easily and profusely, crotalus, creosotum and foss. Blood dark, non-coagulable. Sensation as if a ball rolling in the bladder. Ball rolling in bladder. It is a lachesis. Okay. Headache, pressing or bursting pain in temples, aggravation from motion, pressure, stooping, lying after sleep, dreads to go to sleep because she wakens with such a headache, rush of blood to head after alcohol, mental emotions, suppressed or irregular menses at climaxes, left-sided apoplexy, weight and pressure on vertex sepia like lead in occiput. Respiratory system, diphtheria and tonsillitis beginning on the left and extending to right side, dark purple appearance. Naja, diphtheria and tonsillitis beginning on the left and extending to the right side, dark purple appearance. Naja, aggravation by hot drinks after sleep, liquid more painful than solids. Aggravation, hot drinks, liquid more painful. Oh. Aggravation, hot drinks after sleep, liquid more painful than solid when swallowing. Belladonna brownie and ignatia. Prostration out of all proportions to appearance of throat. Constipation, inactivity, stools, lies in rectum without urging, sensation of constriction of sphincter. Causticum nitric acid. Piles with scanty menses at climaxes, strangulated with stitches shooting upward. Epilepsy comes on during sleep, bufo, from loss of vital fluids, onanism, jealousy. Epilepsy comes on during sleep, bufo, from loss of vital fluids, onanism and jealousy. Menses at regular time, too short, scanty, feeble, pains all relieved by the flow, always better during menses. It is studio notification, very useful data. Menses at regular time, too short, scanty, feeble, pains all relieved by the flow, always better during menses. Zincum. Boiled carbuncles, ulcer with intense pain, malignant pustules, decubitus, dark bluish purple appearance tend to malignancy. Fever annually returning, paroxysmal every spring, carbovage and sulfur after suppression by quinine the previous autumn. Fever, typhoid, typhus, stupor or muttering, delirium, sunken countenance, falling of lower jaw, tongue dry, black, trembles in protruded with difficulty or catches on the teeth when protruding. Conjunctiva yellow or orange, color perspiration, cold, stains yellow body, stains yellow, bloody. Okay. Ledampal, okay, we will read Ledampal. Adapted to the rheumatic gouty diathesis, abused by constitution abused by alcohol. Emaciation of affected parts, Graphitis. Complaints of people who are cold time. Always feels cold, okay, who are cold, always feel cold and chilly, lack of animal or vital heat, sepia, silesia. The wounded parts, especially are cold to touch. Okay, parts cold to touch but not cold subjectively to patient. In some affections, warmth of bed intolerable on account of heat and burning of limbs. Punctured wound by sharp pointed instruments, as awls, nails, hypericum, rat bites, stings of insects, especially mosquitoes. Punctured wound by sharp pointed instruments, as awls, nails, rat bites, sting of insect, especially mosquitoes. Long remaining discoloration after injuries, black and blue, places become green. Pains are sticking, tearing, throbbing. Rheumatic pains are aggravation by motion at night, by warmth of bed and bed covering, only ambulation only when holding feet in ice water. Okay. Hemorrhage into anterior chamber after iridectomy. Yes, MCQ or remedy. Yes. Lilium tick. This is important remedy. Lil Lilium tick. Tormented tiger lily. Tormented about her salvation. Lycopodium sulfur veratrum. With ovarian or uterine complaints. From tomorrow onwards, I will start solving the MCQs live. So I hope people will join. And if you have any books to suggest for solving MCQs, you can comment there. It will be very helpful for me to solve the MCQs. Any book if you suggest, please comment down. It will be very helpful for me. Any book for MCQs, please. Lilium tick, tormented about her salvation with ovarian or uterine complaints, consolation, aberration. Wild crazy feeling on vertex. Wild crazy feeling on vertex. Profound depression of spirit, can hardly avoids weeping, is very timid, fearful and weeps much, indifferent about what is being done for her, anxious about the disease, fears the symptom, indicate an organic affection marked in both sexes. Dispositions to curse, strike, okay, dispositions to curse, strike, to think obscene thing, anacardium and lac caninum, alternate with uterine irritation. Desire to do something hurried, desire to do something hurried manner, yet has no ambition, aimless, hurried motion, listless, yet cannot sit still, restless, yet does not want to walk, must keep busy to repress sexual desire. Must keep busy, sorry, must keep busy to repress sexual desire. Desire to do something hurried manner, yet has no ambition, aimless, hurried motion. Okay. Sensation, heart and circulation. Sensation as if heart was grasped in a voice, as if blood had gone to the heart, feels full of bursting, inability to walk erect. Pulsation over whole body and full, distended feeling as if blood would burst through the vessel, asculus. Palpitation, fluttering, faint, hurried, anxious sensation about apex, sharp pain, chest awakens at night, irregular pulse, extremities cold and covered with cold sweat after eating, lying on either side, rapid heartbeat 1 to 150 to 170 per minute. 150 to 170 per minute. Okay. Stomach and abdomen, constant desire to defecate and urinate with prolapses from pressure in rectum, frequent urging to urinate. If desire is not attended to, sensation of congestion in chest, frequent urging to urinate. Headache and mental ailment depending on uterine irritation or displacement, menstrual irregularities and irritable heart, bearing down sensation in abdomen and pelvis as though all organs would escape, lac canine and murex sepia, supporting uvula with hand with palpitation, menses early, scanty, dark, offensive, flow only when when moving about, cease to flow when she ceases to walk, weak weak and atonic condition of ovaries, uterus and pelvic tissue, resulting in atero and sorry, get open. Headache and mental ailment depending on uterine irritation or displacement, menstrual irregularities and irritable heart. Bearing down sensation in abdomen and pelvis, although all organs would escape, as though all organs would escape. Really, lac caninum murex sepia, aggravation supporting vulva with hand with palpitation. Menses early, scanty, dark, offensive, flow only when moving. About cease to flow when she ceases to walk. Weak and atonic condition of ovaries, uterus and pelvic tissue, resulting in anteversions, retroversions, subinvolution, slow recovery after labor, nearly always with constipation from inactivity. Lithium carb. Next remedy I am going to read is lithium carb. It is a good remedy for gout. Lithium carb. Eyes pain as if sore, pain over eyes with half vision, sunlight blinds him, uncertainty of vision and an entire invisibility of right half of what is looked at. Respiratory system, inspired air feel cold even into lungs. Acidity in stomach, fullness in the pit of the stomach cannot. हेलो अच्छा अच्छा ठीक है What is a peculiar symptom and characteristic symptom? Okay, wait, I'll tell you. Hi, hi, hi. Yeah. So the question is like, what is peculiar symptom and characteristic symptom? Characteristic symptom is like PQRS symptom. Uh, the and peculiar symptom is the peculiar symptom for the patient, like amelioration of the headache by tight bandaging, or amelioration of the headache uh, after uh, beating the head. This is a peculiar symptom of the, one second, hello, हाँ हाँ हाँ, I hope you got the answer. Peculiar symptom and characteristic symptom. PGBGM1. Is it right? Or anything you want to add? If you did not understand, you can ask me again, or I can explain you again. Peculiar symptoms, as I told you, it is the symptom of the person. Adnan, are you doing MD? Adnan, Walaikum Assalam, sir, are you doing MD? No, I am preparing for the MD. I have done my BHMS. Yeah, I have done my UG. I am preparing for the MD. Yes. You're from Father Muller, right? Yes, yes, I'm from Father Muller. Sir, I'm currently in final year and I also wanted to start, and which book is the best? Kaizen Success Turning. Actually, many people say like these three books you have to study, but it is very vast. So stick to the one book and solve the question from the success mostly. Turning, many people said like uh, turning in the MCQs, lots of mistakes are there. So don't go for turning point, stick to the Kaizen and success. So I will also start from tomorrow onwards. I will also start the Kaizen and success solving the MCQs. Yep. But you should know the symptoms. What is accessory symptom of disease and medicine? Oh, so you are asking me from organ accessory symptom. I knew that answer, but yeah, accessory symptoms of the disease and medicine. What is that exactly? Mm, mm-hmm. And medicine? Medicine? Mm-hmm. Mm-hmm. No, 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 it's okay. You can say. Mm-hmm. Like kind of concomitant. What is the accessory symptom of disease? And yeah, kind of concomitant is a, yeah, we can describe like accessory symptom of the disease. A disease which the pathological symptoms, पैथोलॉजिकल जो पैथोलॉजी से हो, दैट इज द एसेसरी सिम्टम, but along with the pathological symptom, other symptom comes that is a accessory symptom of the disease. And the accessory symptoms of the medicine is like while proving the disease, I think while proving the disease, if you get the other kind of symptom, that is a accessory symptom of the medicine. Give me the organal book. Organal book. देखो यहाँ पे होगा book. Any other question? सिक्स्थ है ना मेरे पास. मेरा ही बुक होगा सिक्स्थ और 163, right? Let me see. Yeah, accessory symptom. In this case, the medicine which has been chosen as well as was possible, but which for the reason above started in only imperfectly homeopath, will in its action upon the disease that is only partially analogs to it, just as in the case mentioned above, where the limited number of homeopathic remedies renders the selection imperfect, produces accessory symptoms, and several phenomena from its own array of symptoms are mixed up with the patient's state of health, which are, however, at the same time symptoms of the disease itself. Although they must have been heritable, never or very rarely perceived, some symptom which the patient had never previously experienced appear, or other than he had only felt indistinctly, becomes more pronounced. Yeah. Patient came with the complaining of fever with chills, but some symptoms are not expressing by patients. We are observed that rubbing of hand, it is accessory symptoms of the disease. Yeah. Fever, yeah, fever come patient came with the fever and chill, and this along with the main complaint, if patient is showing or telling the other symptoms, these are the accessory symptoms of the disease. Sir, in North India, predictive Dr. Banerjee Sehgal is a famous doctor in classical. His book is also very good. In South, sir, is there any doctor whose book is required first in classical? Classical, it is not at all easy to practice. For classical practice, you have to have so lots of patience, not patient. बहुत ज़्यादा धैर्य होना ज़रूरी है. ठीक है, पेशेंस यू शुड हैव by giving a single medicine and assuming that the patient will be cured or will be cured, it's very difficult to wait and watch. Okay, so for becoming a classical homeopath, you should have lots of patience inside you. Becoming a classical is not at all easy. I have seen practicing people who practice by giving only one single medicine, that is constitution medicine. I selected remedy as gelsimum. It is a partial similar remedy which when I prescribe next patient tells having crawling sensation in head, it is the accessory symptoms of the medicine, right? Yeah. Yeah, you're right. Yeah, PGBGM. Yes, you're right. How the cure will take place if I choose partial remedy without simillimum? Cure will not take place, but the patient will come. See, if you are talking about uh, in a book like bookish way, so I will tell like okay, cure will not take place, but some relief will be there. By give if a patient comes to you and uh, you are not getting the proper picture of the disease of of the patient, not the disease of the patient, then you will end up with the one similimum, not similimum, or one remedy, which is as you mentioned half partial select partial chosen remedy. In that case, in that case, obviously you will get the the uh, the symptoms will be reduced, but the intensity, the disease will not be cured. In the next, हाँ बोलो. But patient might develop accessory symptom. Okay, accessory symptom comes, then that moment we will take the accessory symptoms and the presenting complaint. Then in that case we will, Sai Vivek, but patient might develop accessory symptom. हाँ, obviously the and that to the totality and prescribe. Same thing we will do. They take the take the presenting complaint and take the uh, what is remaining after giving the partial remedy, what is remaining, the remaining symptoms, and form a totality, then give a medicine. Dr. Sai Vivek, if you choose partial RX, it will not cure. It might give relief to an extent, but you need to see the where it went wrong and how to retake the case. I mentioned it already. It will not get cured, but obviously it will give some relief. In the next moment, in the next follow up, you can uh, form a totality with the accessory symptom or whatever is remaining, or what symptoms is added upon, or whatever is remaining. In that case, you will give the medicine. Which repertoire you are using? Bro, I am using synthesis. I use only synthesis for my case repertorization. Nothing else. Book I read, Kent, BBCR, BTPB or whatever. But yeah, for case, for solving the case, for prescribing to the patient, I am using only synthesis. Bro, use Boric repertory. Thank you, bro. It's good. Okay, bro. Relationship all and all. Okay. Where is that allopath? He Oh my god. He came around 8 o'clock. He came. I think he was waiting for me. So he came and he was like, I asked him what happened. He only replied. He, he was like, yeah, I asked to my one of the orthoped. So he used to give symphytum to the patient. So I was like, okay, okay. Then he asked me few questions, many questions he asked me, like how you treat and all things. At last he was satisfied. Okay, there is something, and yeah, he did not argue like homeopathy doesn't work and all thing, but I think he was like, I asked to many people and I gathered information from many people. So the conclusion was like, okay, bro, yeah, even the orthopedic whom he met, whom he asked, he was also a partial homeopath. So he used to give uh, homeopathic remedy for the patient. Being a allopath, he used to give. Yeah. अरे विवेक, कहाँ है तू? कैसा चल रहा है तेरा क्लिनिक भाई? आई थिंक पीजी बीजीएम, आई थिंक तेरा दोस्त है सर. विच टेस्ट सीरीज इज बेस्ट फॉर प्रैक्टिसिंग एमसीक्यूज? If you are a uh, intern student, I don't think you, but yeah, it's good. Everything is going well. Thanks, bro. Okay, good, good, good. You read success only, Adnan bhai. You read success first, and Alan's keynote. You have to this Alan's keynote. I think yeah, it is good. Kaizen, yeah, Kaizen also. Stephen told me like, okay, Kaizen and success is very good. Bro, I'm also first not believed homeopathy. After I'm taking medicine to the gastritis. I love homeopathy. Still, I'm a student. Oh, nice, 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 nice. I, I had a problem yesterday. I was telling about my complaint. I used to go washroom and all things after take morning diarrhea was there, but it now it is cured, completely cured. So that is a miracle for me. So I started believing. It happened in a first year. I did not know what is homeopathy really. When I joined the college, this I have told to my friends also in the college also. I did not know. At the time of admission, I did not know what is homeopathy and all. But yeah, when I get cured, when I get relief, then I started believing. When I started seeing the cases, I remember in first year, yeah. I was 46 kg, yeah. I was your roommate. I know, bro. I know, bro. I was 46 kg. Now, presently, I am 63. So, there is a drastic change. whatever I was eating, it was not, totally, system was failed. So Vivek, you are doing, uh, you are still in your clinic, or you started preparing for the NEET? I hope you don't start preparing for the NEET. You tell your viewers more about symphytum. I told already, reunion of the bone, and the bone is broken. In that cases, we can give symphytum is a good medicine for the reunion of the bone, or where the bone affection is there. In that case, we can give the symphytum. It is a very good medicine for the bone. Bro, how many patients are you seeing per day? Not much, man. Not much. Four, three, four, four, three patients, three, four, sometimes six, seven. That's it. I don't have a clinic outside. I have in my locality. In my home only I give the medicine. Not only that is cure gastric ulcer and also as internal and external for ulcer. Okay, check boring. Okay. Not only that, it can cure gastric ulcer and also as internal and external for ulcers. Okay, bro. Okay, bro. Good. It's good to see that Vivek is in has good knowledge about. Practically, yeah. Practically, I can understand. You are practicing from long time. I hope you are practicing well, and you don't do PG and all. Right, Vivek? If you are doing PG, if you are preparing for PG, it's not good because you had opened the clinic. You had told me like you started your clinic. Vivek, you publish your cases, man. There are many. Our friends only they used to publish the cases. See, so if you are treating well, publish the case. Delusion of coffee smell. Which remedy it is, bro? Delusion of coffee smell. Which is that remedy? Delusion of coffee smell. Delusion of coffee smell. No idea. Maybe Moscus. Moscus. Herring musk. In Moscus it is herring musk. Delusion of coffee. Delusion of coffee. Maybe belladonna, I think. It's having craving for coffee. Okay. Not delusion. Check in the synthesis. Checked. What are you doing? Delusion. Mind delusion. Coffee. Not there. It's pulsatilla, bro. Okay. Pulsatilla. Okay. Ooh, I don't think this patient will say delusion. Many patients don't know what is delusion, what they are thinking. They don't. Yeah, it is good. Some patient, if they say it is good, So Vivek bro, how is going on your clinic? Tell me something. Okay, I'll read something. Time is still, yeah, half an hour is there. Doctor Lavanya Sai. Okay, so I was reading the lithium carb. Sudden blinds him certainly uncertainty of vision and an entire invisibility of right half of what he's looked at. Respiratory system is inspired air feels cool even at lungs. Acidity in stomach, fullness in the pit of the stomach cannot endure pressure of clothes. Violent pain in the hepatic region between ileum and ribs. Violent pain across upper abdomen. Very stinking discharge of flatus. Genitourinary system. Soreness of the bladder and sharp sticking pain in the neck of the bladder on the right side with the soreness, frequent urination, frequent and copious urination, disturbing sleep, turbid urine and mucus deposit, urine scanty and dark, very acrid. Menses cease suddenly and headache comes on. Pain in the heart occurs before and at the time of menses. Nose is red and inflamed. Sir, can you explain 1052? Sala. Criminal treason against homeopathy. So, bro, I'm not practicing allopathy, yaar. I'm not practicing allopathy. I'm not practicing allopathy. I had told you people were telling I will practice allopathy. I am not at all practicing allopathy. Even I'm not going for the hospital also. I stopped going. I'm just reading materia medica. I'm just reading for the PG. If I get the government college, then it is well and good. Otherwise, I will start my clinic soon. Soon I will start my clinic. मजाक कर रहा था क्रिएशन. सुधर जा बच्चा सुधर जा. क्या ही बोलूँ देखो अभी. अब भाई bro give some tips weight gain. Vivek will say about weight gain and all. Right Vivek? Fear of death, believe the death is incurable. कौन सी मेडिसिन है? कौन मेडिसिन है? Obviously arsenic album. Adnan, fear of death. Vivek, arsenic, yeah, arsenic album, yep. Fear of death, believe the disease is incurable. कौन सी मेडिसिन जाएगी? Obviously arsenic album. Give some tips for weight gain. Bro, eat whatever you get, eat some, eat. How I got this much weight. I started eating. Mom is giving whatever they are giving. I am eating. So I put on some weight. I was so thin that my this and all everything was it was inside. So I started eating. I started eating a lot. No outside food, only home food. Yeah, I do some exercise also, but this much only. I eat a lot now. The only thing is you have to eat. If your digestive system is good, you eat. In at one moment you will gain, weight. You will gain weight. Ask him to take Sarasapilla Q. Ah, Adnan, not Adnan. PGBGM. Yeah, you can take Sarasapilla Q. Mother tincture. Homeopathic weight gainer. Okay, homeopathic weight gainer. Sarasapilla Q. Even alpha alpha you can take. Sarsaparilla Q, alpha alpha, and ginseng Q. All things are Q. Check once in a keynote, bro. Keynote में सरसपरिल्ला. Look, wait, I'll check now only. दूध का दूध, पानी का पानी अभी करता हूँ मैं. सरसपरिल्ला. Sarsaparilla for dark hair in children flare generalities, great emaciation, skin becomes shriveled or lies in the rheumatism relationship for dark hair person children face flabby skin, great emaciation, skin becomes shriveled or lies in the folds, rheumatism, bone and periosteal pain after mercury check, severe almost unbearable pain in the conclusion of the urine passage, gravel material in the system passage. I think it's not there in the Sarsaparilla. It is mentioned in children face like old people. No, no, no. Great emaciation, skin becomes shriveled or lies in folds. Hydrostis. Okay. No, take you, bro, PGBGM. You just take alpha alpha and ginseng. Alpha alpha you take, you will start eating. Sabal ceruleta. No, bro. Sabal ceruleta you give. No, no, no. Sabal ceruleta. No, 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 no. I don't suggest for Sabal ceruleta. Sabal ceruleta, prostate will be enlarged like hell. Sabal ceruleta is for weight loss, not for weight gain. Yeah, shrink करेगा obviously because hello bro Prathamesh. Yes, hello bro Prathamesh. Bro, how can we come to know we are selecting correct simillimum for the disease? Okay, this is good question. How we will come to know if your case taking is good and you have selected all the symptom and you have got the proper mentals, then your simillimum, then you must have got the simillimum. If your case taking, I am third year BHMS ka. Okay, a well taken case is a half cured. So if you have taken the case properly, everything you have considered, then your then case taking is very good. If your case taking is good and you are considering mental, physical particulars, all things, then and you are coming to a one medicine after making a totality, and then obviously you will come to the simillimum. I am confused what to do, I am hopeless. Regarding what? You are in third year BHMS. Okay, no problem. You study. Neither I am getting any prescription nor homeopathy. Hmm. Prathamesh, I am third year BHMS. Okay, I am confused what to do. I am hopeless. Neither I am getting any prescription nor homeopathy. What could I do? Bro, you are in third year. You just study. You just study nothing. No, don't think anything now. You just study. Whatever subjects are there, you just study. Don't think much. You are in a good way, good path. You just study. You are in, but my friends are earning money by doing RMO shipping. Don't do RMO shipping. Bro, RMO shipping you are doing in, you will do RMO shipping in allopathy, no? Then what is the use? You are reading, you are studying homeopathy and doing RMO ship. It's not good. You do, if you want to do RMO ship, you do in a homeopathic hospital, no? That is good. If you want to earn money, I'm third year. Okay, I'm also third year, bro. Yeah. See how good question he is asking. If your simillimum, if your well selected remedy, if you are giving, and after giving the remedy, if the disease is, if the symptoms are decreasing, then it is good. Brother, look once. It's in the question. Is it in the question? Yeah. Some people are doing homeopathy, but I do not understand homeopathy, and there is no one to teach me real practical. See, no one will teach you unless you don't know what is homeopathy and how the medicines are working and what all medicines are there. Nobody will teach you, and at least you should know some medicine. In second year what medicines are going, they have taught you, and third year what medicines are going on. Just read those medicine. If someone is asking, you should know. At least if they are asking for headache, if they are asking give me 5 medicine for headache, what medicine you will tell? Just random medicine you will say no. But if you don't know the materia medica only, then how you will say? If 5 medicines you know about headache, then you will understand, okay, I know 5 medicine of headache, and for every medicine I know the some particulars, some PQRS. Then you will understand, okay, if after listening the patient, after taking the totality, after taking the history, then I will, okay, now I will come to the 2 medicine. Then again you will think, okay, this in 2 medicine which one I should give. Then you will understand. No one will teach you from A to Z. You should, first thing you should understand how many drugs are there and which all drugs you should read. At least 50 drugs you should know, and you are in third year. 50 drugs. Brother, tell him to read only the ordinance, a little too much RX, followed by Kent's 12 observation. Yeah. Do you think I should go to the homeopathic doctor? You should, obviously. If you don't know, you should go and sit with the homeopathic doctor. Thus, just don't apply, don't ask, just sit and listen how they are taking the case. If in your hospital patients are not coming, yeah, many hospitals are there, patients will not come, just go and sit, just listen what questions they are asking. In between you don't ask, just listen them what question they are asking. After that, then you start, once he prescribe the medicine, once the patient go out of the clinic, then you ask him how you give the medicine. Bro, practically how can I know I'm selecting correct? See, if I'm telling you, if you have given one medicine, okay, like, okay, you have taken the case, you have formed a totality, you have given one medicine to the patient, and you have asked the patient to come after 1 week. You gave the medicine, and there are 2 or 3 possibilities. One possibility is like, first the symptoms will aggravate for few minutes, for few days, of not for few days, few hours, but aggravation, then after that amelioration, then it is good sign. Then once one thing will come, there will be no aggravation, only amelioration, that is also good sign. One thing will come, okay, your if your medicine is not perfect good, then there will be no effect. Then you think like, I whatever I medicine I gave, that is not at all working. These observation you have to ask the patient, what is enough, why we take a follow up, we want to know what is exactly happening to the patient. But I am financially poor, I will have to do it, I will send you my application for MD. Okay, fine. Application for MD fees, okay, fine. First you complete your BHMS UG, then we will see. By the end of your UG, you will be, if you are reading properly, whatever subjects are there, whatever exams are there, whatever clinics are there, you have to attend it properly. How can both happen together? I am very confused. Regarding Prathamesh, how can happen? How can both happen together? Study and practical. Study and sit with some 1 hour only with the doctors. How is RMOship and homeopathy possible? If you are doing RMOship for your money, then nobody can help you. But if you are doing RMOship for your learning in a homeopathic college or hospital, then it is good for your future. RMOship you will do, you will end up with earning money, and you will not learn anything. In future you will not be able to open your clinic, homeopathic clinic, because you will not be having so much confidence. Bro, share some tips to remember materia medica drugs. Materia medica drugs. Materia medica drugs. It's very. See, if you are in a college, uh, materia medica, how you read, don't first focus. First you divide what I am going to read. First I am going to read the mentals, or I am going to read the whole picture of the drug, or I am going to read only the particulars. Okay, if you are reading only particulars, then keep in your mind with only 2 books you have to read. I suggest only 2 books. One is Allen's Keynote, second is our homeopathic, this Williams Bory. Keep in your mind, read few drugs, only particulars. Okay, and if in a third year, if you are going to the hospital, observe which remedy they are giving, doctors are prescribing, and after that particulars plus relationship first, I feel okay, that is also good. Relationship also, if relationship means he is talking about relationship, what, like particulars you are reading, at last relationship means you will compare, if not this remedy, I will give this remedy, if not this remedy, I will give this remedy. You will be having lots of medicine. If this medicine not, then this medicine, then you will read 2 or 3 remedy, and you will differentiate the medicine. How can I study for MD? What's fee? Fees, if you are getting a government college, then no fee. You will get. Is it easy to pass AIBGET? No, it's not easy to pass AIBGET. I am also there is, yeah. In a government college you will get stipend like 50, 60, 40,000 per month. In private college you have to give the fee, you have to give. Pass is easy, getting seat is difficult. पास तो सभी कर ले, yeah bro, I can understand your feeling, and you can understand my feeling, what I am going through. एलिजिबल होना पड़ेगा, बिकॉज इफ़ यू आर इन अ जनरल कोटा तो भाई बहुत बहुत घिसना पड़ेगा. पास इज गेटिंग इजी. Total, yeah, 270 seats to 280 around. There is only one MD homeopathic college in GHMC Jalgaon. Yeah, yeah, yeah. I can do it through private. I am in OBC student. But fees will be there. No, if you are doing in a private, fees, lots of fees will be there. Jalgaon, yeah, in Maharashtra, I think Jalgaon, other colleges are not there. So yeah, I'm planning to do from Uttar Pradesh. So their colleges are there, government colleges are there. Yeah, and I native is also there. So I'm planning to do from Uttar Pradesh, UP, because my native I can get the seat. And chill, brother. It's good that I saw you. You are on the path. You are still alive. Oh my God. You did not tell me, Vivek, what you are doing exactly. You okay? I'll call you. I'll call you. That is good. How much minimum money need to do whole MD in low college fee? At least you should 6 lakh. You should have 6 lakh total, 6 lakh minimum. Yep, 6 lakh you should. But why you are doing now? Only you are trying to do I mean MD. Just study. If you are good, if you are in a good place, you start your clinic in Jalgaon, in a village area. You start your clinic. That is good. People will come. Obviously, people will come. Patient will come. Do not take homeopathy in rural area. You become a pioneer, no? You start giving medicine. It's very. I will have to do CCMP again. Don't do CCMP. Don't do CCMP. Don't spoil. If you have decided now only, don't read Mater Medica and all. Just pass. Now only you start doing RMO ship. In any hospital you go, they will pay you 20,000, 15,000. They will pay you, and okay, because the same people come to the city and start homeless people, because the same people come to the city and start homeless. Yeah, that isn't it. See, don't spoil homeopathy. People want cure and relief. That is a obviously Vivek, you said right. People want cure. You teach them. You become a pioneer. You become a torch bearer. You go and start. Now only you start awareing the people like, okay, this is the homeopathy. These things are happening. These things are happening in the homeopathy, and you start giving the knowledge. People will come. Now only in your internship, in your 4th year, people will start coming. If you want medicine, you order some medicine, keep in your home. Whenever you go to the during vacation or any time, you start giving the medicine. First start giving medicine from your home. How can I teach? Have you even go any rural area? Bro, I have gone. I have gone to rural area. I belong to rural area. Okay. Okay, it is up to you how you are teaching, how you are awareing them. Okay, I belong to rural area. I'm a Muslim. I'm from Muslim community. Okay, it's very difficult to teach them. You know, so it's up to you. How first you should understand what is homeopathy. How much salary do I get in RMOship in Mumbai if I work in ICU? You will get more than 60,000 in ICU if you are working. First, let him take medicine for himself. Let him gain confidence. Yeah, he is not. He doesn't have a confidence. He just want to do RMOship, and he want to work in a hospital. At what extent you will work? How many days you will? How you know in allopathy hospital? How is ICU? I have gone there. What is ICU? You know, being a homeopath, you can't do anything in ICU. I have gone there. I have worked in ICU. I have worked in a ward. I have, I have seen 6 or 7 months. I have no. I want to do RMOship and homeo clinic. RMOship, see. RMOship. If you want to earn money, okay, gain some knowledge, have some money, but it is good. But in clinic you should go. If you make a mindset. If you want to do homeopathy clinic, if you want to start homeopathy clinic, okay, but keep in mind you have to study homeopathy. Bro, we choose medicine and expecting to earn money in early 20s, not possible, bro. We choose medicine and expecting to earn in early 20s, not possible. Yeah, it take time. Yeah, obviously it take time. It take lots of time and patience. I told it in starting only. It takes time. You have to sit. You have to sit. You have to sit and wait. People will come. If your knowledge, if your confidence, everything is good. But you will earn once you gain experience. Really. Once you gain experience, you will earn like anything. People will not come and blame you. People will not come and catch you. Sai Vivek, you are right, but I am too much poor. What can I do? How I will pay my fees? If Jalgaon, you are in Jalgaon and you are working, if you are in a government college, then that is good. Don't think about money and all. But if you are in a private college, try studying from now for AIPGT. Yeah, that is good. This is the best. How can I pay rent for my setup? Yeah, if you get a seat in a government college for PG, then you will end up earning around saving around 10 more than 10 lakhs. Then at last you will be able to stand on your feet. And after MD you can start your teaching career also. How can I study? How much mark need for government college, medical college? If you get seat in NIH, you can get 70 to 80K per month. Yeah. Prathmesh, it's very long. Don't think much. Now only you don't think much. First you study UG. Then think about PG. Now you don't think about PG and all. Hmm. In UG, people think like I will do PG, I will this and that. Only in Nehru College, Nehru pays a lot more than NIH, and Nehru pays a lot. But who will stay in the Delhi? You will. In Nehru, I think only 4 seats are there. Yep. Bro, don't come to Uttar Pradesh. There is no good club in the worst place. There is a good club in. I don't want club, man. I don't want club. I'm Prathme, how can I marks? Okay, GMC Gurgaon to get GMC Gurgaon. That is first you complete your UG. Adnan, bro, I don't want to go club and all. I am here in Mumbai since long time, but I want to do homeopathy, from government college. So I have to go like Kanpur, or I think Aligarh is there. Allahabad is there, and Lucknow colleges are there. So I will go. Out of 120 questions, you need to get 80 plus right answer. Yeah. Yeah, that also differs. That also differs every year. How your 80 plus right answer is good or not. Where from you? Thanks, Sai Vivek. Where he's from Hyderabad. It's easy to crack AIPGT, bro. It's easy to crack. No. It's not easy. It's not easy. It's not easy. It's not too much difficult, but yeah, it's not easy. It's not easy. I spent my life in Dehradun. Sai Vivek. What syllabus of AIPGT? Whole homeopathic subjects are there in the AIPGT. Whole from first year to final year, everything. But homeopathic subjects have more weightage, like organ and mathematica, repertory. Three subjects have more weightage. Who dares to say such a math, brother? In 6 months enough for APG? Yeah, 6 months plus internship study. Yeah, it's enough. 6 months plus internship, it's enough. Why are you worried about MD fees and all? First, you should worry about your UG. You're not studying. You don't know homeopathy very well. First, you should learn homeopathy. Once you get confidence in homeopathy in UG time, you will be too much confident for your AIPGT. Bro, we are already preparing for next exam, bro. Good, 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 good. Yeah, there next exam is good. That's why it's easy to crack. Yeah, then well and good, because competition will be there. Competition will be there. So, yeah. But if you have a setup, if you want to start your clinic, don't do PG and all. Just start your clinic and no, no, I will study, but I will have to arrange money for those. Okay, okay, that is good. No issue. PG, BGM, that is, it's easy. Then you study. You should study at least 4 5 hours. Hey Prathamesh, believe in system. Start gaining knowledge. Once you understand, it will be easy, man. Don't take it seriously. We came from that stage. We understand. Obviously, Sai Vivek, we know what we have gone through. We have done a lot of hard works for for just passing the you know UG, for passing first year, second year, third year, fourth year, every year. Whether we studied with you, yeah, it was so tough. Our college, our my college was so tough. They made us, you know, like you have to study, you have to study. Salman was my exam partner. Yeah, Vivek brother was my, you know, we used to sit. I am sitting here. Vivek will sit opposite next to me, and we will read continuously. We will read 2 hour, 3 hour. Then we will take a break. We will go somewhere in a hostel room only. Then again we will come and sit. We will solve the questions. We will do this and that, everything. We have a pictures of, you know, sitting together, enjoying. During exam time, we used to sit for long time, you know, for long time. We share our knowledge. We share our this thing we should read. This thing we should read. At last, we passed with a good marks. आज मैं पढ़ भी नहीं पाया थोड़ा भी. I have to start reading. It's okay. Which batch you are, bro? Uh, 2028, 2018, sorry, 2018. Bhai, how much you will earn from live video? I will also start. Bro, you start, bro. We will discuss. Like me, you, Stephen. We will call our guest, our old haramis. Sorry for using all these words, but yeah, we will at least we will start. We will sit. We will discuss the cases. That is very good. I and just make. I will suggest some. I will give you a tip. Just follow. You should have at least 50 followers or subscriber. Then I will do everything. Okay, I will join you. We will discuss. Earning that you leave, bro. Earning will be there, but discussion should be there. Proper discussion. So at least we sit. Uh, we will we will call our guest, like, okay, today our guest is Stephen Thomas. Today our guest is Sarang Paul. Today our guest is Ali Bhai. Today our guest is Dhanush Bhai. So we'll call everyone and we'll join and we'll ask and we will talk about homeopathy, about their treatment, their plan of treatment, their what exactly they are doing. It is good. Just 50 subscribers you should have. Now YouTube is very liberal. If you want 50 subscribers, I will give you. Just make 50 subscribers. We'll start. We'll start our podcast, live podcast. We'll sit and talk. We will discuss the cases. You discuss few cases. I will discuss my cases. And yeah, healthy conversation, 1 or 2 hours. It will be very good. It will be helpful for the society. It will be helpful for the Prathmesh like student. Those who are in first year, second year, third year, they will learn. Okay, these things are discussed. They are discussing, so it will be good. Dr. Vijay Krishna. Vijay Krishna. No, I don't know Vijay Krishna. Vijay Krishna. Karnataka, Bangalore. No, Bangalore. No, Bangalore. I don't know. I follow only Hahnemann. That's it. What Hahnemann has done, same I follow. GHMC Bangalore, HOD of maternal. Oh, nice. GHMC, from my batch, I think someone has got the seat. I'm not sure because I did not ask many people, but yeah, I think few people have got the seat in GHMC. Yeah. Vivek, are you there? So, any more question? Now the time is 11 o'clock. It's around 2 hour I was live. थैंक यू ब्रो फॉर योर हेल्प. ओके, मोस्ट वेलकम. सब्सक्राइब कर लो चैनल को भाई. सब्सक्राइब कर लो. Thanks a lot. Thanks a lot. Most welcome. If you have any query, you can ask anytime. You can come to the. If I'm live on YouTube, you can come and ask your queries. Uh, you can call me. You can text me on Insta. Anywhere for any help. So tomorrow I will either I will solve the question MCQs or I will start reading organ of medicine. I think organ I should read. It's too early to start. Okay, I'll do one thing. I'll solve MCQs and reading organ both at one time. That will be good. I'll solve the MCQ. If I'll not get the answer, I'll check in organ of medicine book and we'll find what the difference and which is the right answer. Okay. Any other query? Anything else to ask? I thought today I'll finish this, but yeah, lobelia, many medicines are still pending. Lobelia, lycinum, macar, magnure, medorinum, melilotus, mercurius, merxol, mesarium, millifolium, murex, muriatic acid, naja, natrum carb, natrum mure, natrum sulf, nitric acid, nux moscata, nux vomica, opium, oxalic acid, petroleum, petroselinum, phosphoric acid, phosphorus, physostigma, phytoleca, picric acid, picric, platina, plumbum, podophyllum, sorinum, pulsatilla, pyrogenum, ranunculus, ratania, rheum, rhododendron, rustox, ricinus, rumex, ruta, sabadilla, sabalcerulata, sabina, sambucus, sanguinaria, sanicula, sarsaparilla, Sickle, selenium, these many medicines are pending. Okay, so bye. Thanks for watching.